co-chairs. For the advisory committee, I am from the AAA 6 in San Francisco. So welcome for the new year to everyone, both members and guests. Everyone should have gotten the meeting materials. It included agenda, minutes, the committee work plan, the ADRC Consumer Experience Survey Summary, and CDA updates. So if not, put it in the chat and we can make sure you get whatever document it is you need. So I think I will turn it over to Wilson to get started to introduce and give us some housekeeping rules.
Great. Thank you, Cindy. And welcome, everyone. My name is Wilson Tam from the California Department of Aging. I do have the privilege of leading our person-centered navigation branch here at the department, and that includes ADRC and also our health insurance counseling and advocacy program. I will start off with our housekeeping. So just some general info. This meeting is being recorded and will be posted onto our CDA ADRC website. And I do recognize we have our ASL interpreter, so I'll slow down a little bit as a reminder. And so for accessibility, we do have, again, ASL interpreters today, and they have spotlighted themselves. We also have closed captioning available, and that has already been turned on. If you need assistance at any time, please email adrc@aging.ca.gov. The mailbox is being monitored in case you need any assistance. In regards to communication, we ask all attendees to remain muted unless presenting or called upon by the chairs to speak. To enable us to know who is speaking, please say your full name before speaking. For those that are attending by Zoom, you may use the raise hand function and then unmute when called upon to speak. If you're dialing in by phone, press *9 to raise your hand, and when called upon, press *6 to be unmuted. There will be a public comment period at the end of our meeting for non-committee members to speak. So that would be, I believe it's the 4th agenda item from the end. And lastly, chat and the Q&A function can be used to communicate questions to the host. With that, with the housekeeping items done, we are going to move forward to roll call, starting with our 19 members. When I call out your name, just say present, and feel free to say a few words if you wish to. Starting with our Independent Living Center representatives in alphabetical order. Carl Sigmund from Freed.
Wilson, this is Carl's assistant, Courtney. Carl is on his way.
Got it. Okay, maybe we'll hear. Thank you, Courtney. Next, we have Larry Grable from the Service Center for Independent Life.
Present. Thanks.
Thank you, Larry. Next, we have Letty Zuno from Access to Independence.
Good morning, I'm present.
Great, thank you. Next, we have our Area Agency on Aging, or AAA, representatives, starting with Cindy Kaufman from the San Francisco Department of Disability and Aging Services.
Present.
Thank you, Cindy. Next, we have Elaine Clark from the Napa Solano Area Agency on Aging.
Present.
Thank you, Elaine. Next, we have Joe Cobrey from Passages.
Good morning. Glad to be here.
Thank you, Joe. And last but not least, for our AAA representatives, we have Victoria Jump from the Los Angeles County Aging and Disabilities Department. No, Victoria. Let me know when Victoria arrives. For our consumer caregiver representatives, we have Andrea Dubrow.
Good morning, everyone.
Good morning, Andrea. Next, we have Carol Leish.
Good morning.
Hi, Carol. Good morning. Third, we have Erin Crutcher. No Erin yet. Okay, and then Tammy Harsh, she did express that she will be not be able to make it today, so we'll catch her the next time. And last but not least, William Reed. Okay, team, let me know when William arrives. Our other long-term services supports representatives, we have Helen Lopez from the California Senior Legislature. She did mention that she won't be able to make it today and express her regrets. Second, we have Kelly Takasu from the Alzheimer's Los Angeles.
Present, and Happy New Year.
Happy New Year. Next, we have Ramon Postelblanc from the San Francisco State University. Ramon? Okay, no Ramon yet. Next, we have Rita Sayans from the AARP, California Executive Council. Not reading that. Next, we have Sherry Raisler from the Society for the Blind.
Good morning. I'm present.
Good morning. Hi, Sherry. And to close out our 19 members, we have Sophia Rodriguez, who's a healthcare leader and also a certified administrator for assisted living facilities and RCFEs. Sophia? Okay. If any of those members arrive, we'll go ahead and announce them. Next, we'll move forward to our ex officio members. And I'll start off in alphabetical order of the acronyms of each of the associations, starting with C4A, the California Association of Area Agencies on Aging. C4A? No Christina yet? Okay. Next, we have CalVet, California Department of Veterans Affairs.
David Lawrence here from CalVet.
Thank you, David. Next, we have CCOA, California Commission on Aging. Okay. Next, we have CDA, California Department of Aging.
Hi, good morning, everybody. Mark Beckley. Good to see everyone this morning.
Good morning, Mark.
Good morning. This is Mike with PICAP. Good morning.
Good morning, Mike. Thank you. Next, we have CFILC, California Foundation for Independent Living Centers.
Good morning, Dan Okenfuss here.
Thank you, Dan. Good morning. Next, we have DDS, California Department of Developmental Services. Okay. Next, we have DHCS, California Department of Healthcare Services.
Hi, good morning. Gina Gunther here.
Hi, Gina.
Good morning.
Next, we have DOR, California Department of Rehabilitation.
Hi, good morning, everyone. This is Regina Catamarti with Department of Rehabilitation.
Good morning, Regina. And last but not least, we have SILC, State Independent Living Council.
Good morning, everybody. Carrie England, also joined by Allison Viramontes-Nar.
Terrific. Thank you. Any members that have joined us while we were doing roll call and we have missed and want to introduce yourself? Okay, hearing none, I'll turn it back to you, Cindy, for our next agenda item.
Great, thanks very much, Wilson. So I will actually turn this over to Eli, who has an announcement.
Okay. Good morning, everyone. It's great to see you. Can you hear me okay? Yes, all right. This is really exciting, and also it's part of my IL independent living grieving process after 17 years as director at Marin Center for Independent Living. I have transitioned on. The exciting thing is that I haven't gone very far. I am now working with and for Cindy Kaufman and the city of San Francisco as the new director of the San Francisco Mayor's Office on Disability. With that transition, we need to have a new co-chair, and I am thrilled that CFILC has voted, and I believe unanimously, to support and elect Letty Zuno as the ADRC co-chair with my new boss, Cindy. So, I just want to say for the 17 years that I've been involved in independent or as CEO of MCIL, and the over 21 years I've been involved in independent living, I am so proud and honored to see the growth of the independent living network, the growth of the ADRC network, the collaborations that are happening, the work that we have done, whether it's during COVID, wildfires, every day. It's impressive, and I'm very excited to see the ADRC network and leadership, all of you continue to expand this visionary work, and know that you have a friend and an ally, another friend and ally in the city of San Francisco and in the mayor's office in me. So with that, I'm going to pass it back to Cindy and Letty, and just an honor, a privilege, and really, I'm just so proud to see what we all collectively have developed, and proud to see what will happen as we continue this work ahead.
Eli, thank you. On behalf of the entire advisory council, I can't express how much we appreciate the work you have done. You have been truly a visionary, and some of the things you have helped create across California has been just inspiring. So I want to thank you for your work. And Eli and I were laughing yesterday because I was sending him an email going, I'm going to miss you, but I'm going to see you more than I do now. So it's a change of roles and relationship. And I am very lucky. So, but we will truly, the council will miss you, but you will still be providing us with a lot of good work and guidance. So thank you for your years of service. And I will turn this over to Dan, who can introduce Letty.
Thank you, Cindy, and thank you, Eli, for such a wonderful service to this community and to independent living. It's been an honor and privilege. I know you beyond the IL world, so it's sad to see you go, but great to see you in your new role. And I look forward to sending you my San Francisco parking tickets for fixing. Yes. Next, let's welcome Letty Zuno to this advisory committee. Letty Zuno, she holds a master's degree and Juris Doctorate degree from Cornell. She has worked for Access to Independence for over 15 years and has worked with individuals with a wide range of disabilities on their pursuit for independence. Letty also adds, she's no stranger to this group. She's a co-chair of CDA's ADRC Data and Outcomes Group, and happy to be here in this new role. So Letty, welcome to the cool kids of the ADRC Advisory Committee.
Thank you, Dan. Thank you to everybody within CFILC for their support and especially their trust in me to carry on our collective mission of all of those in the Independent Living Network, and our partners at the AAA, and as we're forming these ADRCs. I'm incredibly honored and intimidated to replace Eli. He's irreplaceable. So I hope you all bear with me as I stumble along a little bit to try to fill his shoes. But it is really exciting to see those of us in this field, in this network, also branch out, because the more we branch out, I think the wider our voice, the bigger the impact. For those of you, again, I don't want to repeat a lot of what Dan said. I'm the Executive Director, Access to Independence, San Diego. We also serve Imperial County, and we're also on the island of Oahu in Hawaii. I've been with Access to Independence 20 years, and am also a core partner of Imperial Valley's ADRC. So thank you, everyone, and I'm excited to get to work.
Letty, thank you very much. I am really looking forward to getting to know you better and working with you on this. I love the creativity and the thought partnerships in this group, and you certainly have been that so far. So I'm very much looking forward to co-chairing with you. And with that, I will turn the action item, the number 3 item on the agenda, over to you to introduce.
Thank you. Action item number 3 is the review of our agenda and the approval of the previous meeting minutes that hopefully everyone has and has had an opportunity to review. We would ask for comments at this time and seek motion to approve that agenda and the meeting minutes.
I'll move acceptance of the minutes.
Thank you. We have a motion. Is there a second?
I'll second that. This is Victoria.
Thanks, Victoria. Are there any comments, any feedback on either the agenda or the meeting minutes? Seeing none, this action item passes. And we'll move on to agenda item number 4, California Department of Aging updates.
Great. Thank you so much, Letty. And Wilson, I don't know if you'll be sharing the presentation or if I should share my screen.
Mark, up to you. Let me make sure that you are a co-host and then that you have the sharing capability. Do you have a preference, Mark?
I don't know. Either way is fine with me.
Okay. If you have it up, go ahead and share it in that case, and then you should be able to now that you're going.
Okay. Stop. Okay. So I first want to start off by thanking Eli for all of his great work with the ADRC committee and with Marin ILC. It's been just a true pleasure getting to know Eli over the years, and I've learned so much from him about disability issues. So really want to just thank you for all of your great work, Eli, and I'm just glad to see that you're still going to be in the network and you'll be leading on disability issues in San Francisco. So hopefully we have an opportunity to continue to work together. And Letty, welcome and congratulations on being co-chair of this committee. Really looking forward to working with you as well. Okay, I think before I get started, this presentation was put together a couple of weeks ago. There have been obviously some recent developments in the state that I'd like to start off by highlighting. First and foremost, of course, is the LA wildfires, and obviously our hearts go out to the people, the residents of LA in the affected areas, and even in the outside of the immediately affected areas, just with smoke and all of the just sort of like recovery and response issues. At the state level, we're really trying hard to support our local partners, the AAAs down there, CBAS, MSSP sites, wherever we can advocate or secure resources through our Office of Emergency Services. We're absolutely doing that. Really trying hard to see what flexibilities we can provide in terms of funding, so that funding can be put first and foremost put towards disaster response and recovery efforts, and we'll continue to do that. But obviously, it's just such a dire situation. So, but we're in full support. On the budget front, the governor did release his budget last week. When it comes to aging programs, we did secure some additional resources. One is a continuation of resources that our local HICAP providers have been receiving for volunteer coordinator positions. That thankfully continues forward. We're currently working with a consultant right now to develop a more robust HICAP modernization plan. And as that plan gets developed and unfolds, we'll share it out with this committee. We also secured resources for a new MSSP software system. That's really exciting news. This is something that the MSSP providers have needed for a very long time. So the idea is to set up one enterprise system so that all of our providers are on a common platform. We can help and assist them with any technology issues they might have. And I think data reporting will be much more easier and consistent through the new system. Okay, so I'll get into the updates that we'd prepared for today. I want to welcome all of you. I think know Anna Acton. She has served on this committee for a very long time. Went to the Department of Rehabilitation as the deputy director over the Independent Living Center services. And we are just so grateful to welcome Anna to our organization. She is taking the role as the assistant deputy director for the Division of Research, Policy, and Equity. And, she's such a pleasure to work with, such a great thought partner. And it really shows, as you'd mentioned, Letty, kind of like expanding, growing, branching out. This just shows the sort of even more strength in collaboration between aging and disability within CDA. And I'm just so happy to have Anna with us. And then I can't remember if this was previously announced, but Susan Rodriguez, who was previously the head of our MSSP branch, moved over to set up a new office for us, the Office of the Patient Representative. She is now going to be the assistant deputy director for our Home and Community Living division under Denise Leiker. Susan will be overseeing our ADRC and HICAP bureaus, as well as our Health at Home branch, which includes MSSP and CBAS. So really great to have some strong new leadership to support both of these divisions in our department. And then I also want to recognize, Christina Mills, again, who several of us have worked with as the new C4A executive director. Just so great to see that strong leadership continue at C4A, and really looking forward to working with Christina. Okay, so I want to get into one of the major system reform efforts that we have underway at CDA. I think I've talked about this before. I'll go into a little bit more detail about it here. This is called our CA 2030 effort. We had several members from C4A, from CFILC. Eli was on the committee, our AAA directors, local county supervisors, really thinking about how do we strengthen the local area agency on aging network? What more can we do to really, strengthen practices, processes, resources? So this was SB 1249 was a bill that was sponsored by the California Commission on Aging. It was signed into law by the governor in September. And the main goals of the CA 2030 effort that were contained in this bill are to identify core Older Americans Act programs and services, develop key performance measures for these core programs, review the intrastate funding formula. I'll talk a little bit more about these in a second, and then update our planning and service area designation and de-designation criteria. So all of these, the bill was signed, this law is in effect, and we're actively working with the AAAs to really talk about what we hope to accomplish in each of these areas. What guides us in this work are these core traits. So when we think about building a stronger aging network, it's really guided by these values and these traits. We want to make sure that aging and disability moves forward together, that we're not just addressing older adult issues or disability issues, but we're really addressing issues that affect both populations, that our work is inclusive and equitable, that the work that we do applies to all Californians. And we want to make sure that we really focus on diverse and underserved communities, that our system becomes well-known and accessible. I always say AAAs, ILCs are the best kept secrets in California, and it really shouldn't be that way. They should be just common household terms that people know. If I need help, I go to these places. That it's consistent, that you get similar quality of service wherever you are in the state. So if you're in Southern California, the quality of services should be no different than what you get in Northern California. That the services are locally responsive, that while we want to create a standard for the state, we also understand certain communities might need additional supports or services in certain areas in other parts of the state. Like you can think about maybe transportation in rural areas, for instance. That we are always strategic and action oriented. We think of good ideas, we collaborate, we understand what we want to accomplish, and then we take action on it. We don't just keep things cooking on the stove for too long. That our work is performance-based and outcomes-driven, that whatever we do, we measure, we track progress, we look for improvements, and we hold ourselves accountable. And then finally, that everything's integrated. So we talk about social systems, we talk about health systems. Again, we want to break the silos, and we really want to start integrating our services so that people don't have to go to 5 different areas to get help, the holistic help that they need. So for CA 2030, I mentioned the areas of focus, the planning service area and AAA designations. So right now, if you want to be a AAA in federal law and in state law, there's certain criteria you have to meet. You have to be fiscally sound, you have to have a sufficient staffing structure, those things. They're very broad in general. We want to get more specific about what exactly that means. Things like AAAs should be expected to form strong partnerships or have a history of strong partnerships. They should be maybe experienced in, handling various different funding sources and have access to maybe supports, demonstrated access. Core programs and services. Our initial focus in this area are services that are already commonly provided by the AAAs. So nutrition programs, they're all required to deliver them. That's a core service. Family caregiving service. Again, all AAAs deliver family caregiving in some fashion. That's a core service. Legal services, again, required under the Older Americans Act. Everybody delivers legal services. So what we plan on doing is once we have, agreed with AAAs what the core programs are, then we start building performance measures around this. What does it mean to provide quality meals? What are the volume of meals that we're delivering? Is it cost effective? Are there better ways of doing this? So by setting up these performance measures, we can really track progress in these areas. And then our funding formula. Our funding formula hasn't been updated since the mid-90s. And really, ACL recommends that you update your funding formula every 5 to 10 years. So we're really way overdue. So when you look at our funding formula, there are some factors in there that you'd expect. Percentage of population, 60 plus, people who reside in rural areas. There's some standard factors that are already incorporated, but should we expand those factors more? Should we look at people with disabilities? Should we look at maybe equity, right? Serving diverse or underserved communities. So those are some changes we're contemplating for the funding formula. And as we contemplate these changes, again, we're working hand in hand with the AAAs. Right now, CDA is developing scenarios. These scenarios will then be brought to the AAAs and then discussed. And then we'll kind of talk about the direction that we're headed in forums such as this committee. All right. Aging and disability, no wrong door system. This is something that's really a key focus of CDA right now, and something that we're really excited to hopefully get launched in the near future. So the no wrong door system, I know I've talked about it with this committee previously, but the idea is to increase the access to and understanding of programs and services that can help older adults, persons with disabilities, and caregivers. As we know, it's a maze, right? If you need services, you might be talking about to 5 different state agencies. You need medical services, you talk to one agency. You need transportation services, it could be a different agency. You know, you need IHSS service, it's another one. But, you know, creating that one-stop shop, just having that single website or single call center that you can call that will help you get access to and information about services that you need. We've started off by starting a state leadership council at the state level. This consists of ourselves and DOR's co-leads of the No Wrong Door System effort, as well as DDS, Social Services, and the Department of Healthcare Services. Those are our initial core partners. What we plan on doing with these partners is really providing information on a website, publicizing, promoting the services, and then over time we'd gradually expand to additional departments. Could be employment, transportation, housing, to make sure that we really build out all the supports and services that older adults and persons with disabilities could need. One of the key components, like I say, is this website or interactive resource guide. Some of you have seen things like 211 systems, Find Help, Unite Us, those types of platforms where you put in a zip code, you put in a search term, and then it will it'll give you a listing of different providers in your area. This provider directory that we're envisioning is really going to be catered and tailored towards older adults and individuals with disabilities. So the searches will be confined to services and supports that really help these populations and would be populated with most current information. For instance, on a website like this would be promoting resources for folks around the LA fires, disaster resources. And then the second component is the customer, what I say, contact solution. It may not be a single center. It might be a federation of, say, AAAs, ILCs, or others that really help to support folks as they do today. All right. So that is our No Wrong Door system. And as we continue to build this out, we'll definitely be talking with all of you and presenting on the concepts and getting your feedback. Okay. The other exciting news is that we have a new strategic plan. We have one listed on our website now. And Wilson, if you could share the link in the chat, I don't know if we have chat enabled, but if we could just send out that link, that would be terrific. And in our new strategic plan, we have 3 core areas, what we call the 3 Ps identified: people and populations. So for this area, this is really focused on program improvement, accessibility to programs, availability of programs. So really program improvement. The second one is performance. And we look at performance from 2 perspectives. One, like I mentioned previously, how are we doing in our programs? What sort of data and metrics can we capture to show the good work that all of you are doing? And how can we also assess where we need to improve? We're also looking internally at CDA. What can we do to streamline our work? Can we streamline contracts? Can we do something better for all of you so that the administrative burden is low and you can really focus more of your time on the core work of the programs? And then finally, partnerships. So this is state partnerships, as we're doing through the No Wrong Door system, partnerships with other state agencies to set up the system, partnerships with the federal government for grant opportunities, for technical assistance, and then partnerships with, you know, diverse communities throughout our state. So tribal partnerships, you know, other sort of like local community partnerships, whatever we can do to promote our services to all populations. So please take a look at that plan, and I think maybe in a future meeting we can also present more on our key goals and objectives. But some of the components in the plan, like some of our key objectives, would be things like the No Wrong Door system, CA 2030, and another one I'll be talking about here in a second. All right. So the master plan for aging, another exciting development we have is that we received feedback from our master plan for aging stakeholders and work groups. They have proposed a new set of initiatives for the next 2 years. We will be unveiling those initiatives soon. So please be on the lookout for that. Really exciting. And I think some of the initiatives will be very, very obvious and common to you. It's things that we've talked about, like housing assistance, transportation assistance. But yeah, be on the lookout for that soon. Oops. And then we had our day of action. For those of you who attended, I'm sure that hopefully you felt the excitement and the buzz in the room. It was so great to see just our federal stakeholders, so Secretary Basura, who's able to make it, our legislative leaders, state leaders, showing up, stakeholder leaders in this one forum to really keep the momentum going in the master plan for aging and really hone in on the key ideas, the key system improvements that we need, and just to carry this work forward. So thanks to all of you that were able to attend, and yeah, it's really great to be able to launch the new initiatives. Okay, and then the MPA timeline. So I won't, go too much into this, but this is basically just the process we use to create the new initiatives and then our timeline to launch the new initiatives. All right, and then the final effort I'll talk about is the HCBS gap analysis. So we talk about the No Wrong Door system. We talk about promoting what services and supports are available to older adults and persons with disabilities in our communities. But guess what? As we know throughout the state, there are gaps. There are not MSSP sites in every part of the state. There aren't CBAS centers in every part of the state. And I mean, we could just list a whole number of other gaps. So what this effort is really targeted to is to look statewide, what services and supports are available in individual counties, cities, and then what can we do, what roadmap can we create to make sure that everyone has access to similar and consistent services throughout the state. So we are in the process of wrapping up what we call our gap analysis. What are those service gaps? And then the next effort will be a roadmap. How do we go about filling in those gaps? There's two components to this. There's Medi-Cal services that are being led by DHCS, and then there's non-Medi-Cal services that are being led by CDA. We are using a common vendor on this on this project, Mathematica. So the two are really blending and tying nicely together. And then this is just a brief overview of the goals and objectives. I've kind of talked about that. So this just explains it a little bit more. All right, and then this just talks about the goals, which I've already kind of covered. I'll just say that as we go through this process of, creating a roadmap and identifying the gaps, there will be like progress trackers and that kind of accountability that will be built into the process. And again, this is just a sampling of some of the services and supports that we're talking about: nutrition, caregivers, supportive services, ILCs. So yeah, these are the kind of services that will be addressed. And then this is just a timeline. As I mentioned, we plan on releasing the gap analysis in the summer of 2025. And then the fall of 2025, we should have the roadmap created. And again, we will do presentations, I'm sure, for this committee to really go over the key findings in that work. All right, and that is the end of my presentation. So I will stop sharing. And happy to answer any questions you might have if we have time, but I defer to you, Cindy and Letty.
Oh. This is Rita. I have a question.
Go ahead, Rita.
What is our sense of how we will be impacted by any federal policies at this point?
I mean, honestly, we can't say. I mean, if you're talking about the new federal administration, we'll have to see what they propose. Obviously, it's something that we'll be keeping a very close eye on. I mean, anytime you have a change in any administration, we'll always be on the lookout for any key substantive changes. But at this point, until the new administration comes in, we can't really say.
Okay, we're counting on you to warn us when you know.
Yeah, I mean, absolutely. If there's any key changes, this will obviously, yeah, definitely be shared out. I mean, if not by us, I'm sure you'll see things in the newspapers and things like that. But yes, as soon as we know, we'd be sharing information.
Thanks.
Any other questions for Mark?
Just while I have a second, I didn't know he was going to be on today, but I want to thank Michael Costa for his phenomenal leadership of C4A. I'll just say it's been such a pleasure working with Michael. It's been such a close collaborative relationship with C4A. Anytime we had hit a roadblock or there'd be some sort of like key issue that we had to resolve, he was always there to pick up the phone, to talk things through, to take quick action. And I just want to really recognize Michael just for the great work he's done as C4A Executive Director.
Hear, hear.
Thanks, Mark.
Mark.
You're going to get a lot of recognition here, Michael, so stay tuned.
Yeah. Get ready.
If no other questions, Wilson, did you have some updates?
I just wanted to piggyback on what what Mark had just updated on and add on specifically to ADRC, and that we have expanded our ADRC network to 24 designated and 2 emerging partnerships that span across 31 counties statewide. This includes 27 of the 28 ILCs. Congratulations. And then also 23 of the 33 AAAs as well. Right now, we are working with Napa County and also our Los Angeles County partners towards emerging and designation status. So more to come on that, and hopefully more news to announce at our next meeting. Thanks, Cindy, for the opportunity.
Okay, sorry, always looking for a mute button. So next up is the ADRC funding updates. Wilson, I'll turn it to you to start.
Sounds good. Wilson again, CDA. So for infrastructure grants, just a real brief update. As Mark mentioned, the governor's proposed budget has been released. Our ADRC infrastructure grants of 10 million has stayed intact. No changes at this time. So we are working internally to release the 2025-26 contracts at this time. I will turn it over to my colleague Janice Ho, who will talk more about Medicaid administrative claiming. Janice?
I'm sorry. Could I intervene? Just add something onto the funding?
Go for it.
Okay, great, thanks. Yeah, I just really want to emphasize, this came up in recent ADRC core team meeting, just about the funding and spending of ADRCs. Just to highlight, we are seeing spending levels remain relatively low, which is always a cause of concern, right? We know that there's a need out there, and it is important that we do what we need to do, hire additional staffing, to make sure that we are spending our infrastructure grants. I also think that as we establish this no wrong door system, that the ADRCs could be so vital to the success of a no wrong door system. One of the key components of a no wrong door system is enhanced information assistance, person-centered counseling, things that you and your staff are just very good at. So as we launch that, we would look to ADRC to kind of like support the no wrong door system effort. But again, as we get more information about our plans for the no wrong door system, we'll talk about that connection with ADRC, AAAs, and ILCs.
Christina, I see your hand.
Thanks.
Welcome.
Thanks. Sorry I'm late. Quick question. Thank you for that, Mark. And I'm probably just behind in the knowledge right now. Was there any trends on why the spending has been low? Or can you speak to that at all in terms of the reasoning?
I'll turn to Wilson on that. I know that we do have meetings with the ADRC partners. I know that the reasons are different depending on the different ADRCs, but anything you want to say on that, Wilson?
Yeah, it's Wilson, CDA. Yeah, like Mark said, it is different depending on ADRCs, but I think the most common thing that we've heard is relating to workforce. And just especially, going through the COVID period, there has been, challenges in getting qualified, I guess, staff to come on board and also to retain staffing as well. So that's been the most, I think the more common theme that we've heard.
Wilson, I'd just like to add a little something to what was said that Mark didn't mention, and I appreciate that he didn't. But one of the things that happens when we don't spend the money is the legislature begins to ask whether or not we need it. So it's obviously everybody's having trouble hiring great people to do this kind of work. But over a period of time, we could lose that money if we don't spend it.
I want to thank you for raising that, Rita. That's absolutely right. I hate to say it, especially when budget time gets to get tough. What finance will do is they'll look across programs in different departments. And if they see low spending in certain programs, those are usually the first to get cut. And we've worked so hard for so long to get funding for the ADRCs. This is something that would be awful to see go away. And again, I think that there's really a great opportunity if we do a no wrong door system in the near future. I'm sure that you're all, like have lots of workload, right? And I think that, something like a no wrong door website would drive more calls to your centers. So, if you're not staffed up now, I would really recommend getting there. Because I think if we are successful in developing this, I think the workload will come to you, like increased workload.
And I appreciate that, Rita. This is Christina. Just to add on and catch up, has there been an opportunity for the AAAs and ILCs to come together and strategize on best practices and getting up to spending levels needed? I'll take that as a no. Thank you.
Okay.
Yeah, so sorry, Cindy, Letty, may I speak? This is
Yes.
This is Wilson, CDA. At our last meeting with our core partner executives, so that's the AAA and the ILC executives, we did offer an opportunity for like a CDA facilitator, CDA hosted, we call it office hours to have ILC and AAA have these type of discussions. However, we haven't heard additional feedback and we haven't started these office hours yet at this point. But Christina, you do raise a great point that may be a great opportunity, whether CDA facilitated or whether it's another organization that's facilitated to have these type of discussions.
Hi, Wilson. We do have a hands up by Michael Costa.
I'll defer to Cindy and Letty.
Hi, go ahead, Michael.
Yeah, I hope it's okay that I can kibitz a little bit here because I'm actually no longer on the committee. I think it's important when we think about the funding to always remember there are really two components of it. One is for designated ADRCs to spend money on operations and development, but also the other component that is important to keep in mind is actually the emerging ADRCs that need money, to actually continue to develop and be designated. And one of the two emerging ones that are in the hopper right now is LA County, and that's got to cost some money. So I think let's also keep in mind, or I would say as an interested outsider, let's keep that in mind going forward when we have the discussions. Thanks.
Thanks, Michael.
And Cindy and Letty, I think that Susan Rodriguez had her hand raised earlier.
She did, and then she popped away. So Susan, did you still have a question?
I do not, sorry.
That's okay.
Couldn't
you
find
keep your
my
hand down. We
audio.
just wanted to make sure.
Thank you.
We do have a question from the attendee in the questions box. This attendee asks, are there any updates on the funding equation methodology? How is funding being distributed? And what is what needs to change so that we can spend down across the state.
I could speak to that. Liz Wilson.
Thanks, Wilson.
So there hasn't been updates on the funding equation or methodology at this time. It's the same one that we've had for several years at this point. There's a base funding, and then in addition to the base funding, there is a allocation that's based on geographic area and population size. Reading through the question, see if there's anything. Oh, looks like it's been answered. So I hope that answers your question. If not, please let us know.
Thanks, Wilson.
Carol just put the question in the chat. What ideas do you have of things to put in a No Wrong Door website? When would you see this happen?
Yeah, sure. So with the No Wrong Door website, again, a lot of you already have your local service provider directories, right? It's either something that someone can go online and do a search for. It might be static. It might be slightly interactive, maybe have some logic about putting in your zip code so that you can, and, a lot of them have geo mapping. So here's the nutrition providers that are closest to you or further away. And then they also contain profiles. So it might be just a brief description of the provider, maybe the types of meals that they serve, or if it's a transportation service, the type of transportation that they provide. And then there's, usually identifying like a phone number, email address that you can contact, or website URL. So that's really what, the provider directory would look like. And again, I encourage you, if you're curious to see what we might be thinking about in terms of an online directory, you can go to any of the 2-on-1s and just look at their websites. It'll have a similar look and feel, although there will be more aging and disability information embedded, just other resources, toolkits. It would kind of serve as a resource hub of sorts. And then there's a contact solution. So, if somebody is having difficulty navigating services, they're not really sure what's best for them, we would have our 1-800 number and then some contact information for, ILCs, so that they could call up somebody and then, the AAA, ILC, ADRC provide services as they normally would. I'd say one enhancement is, I think for some contact centers right now, somebody will call and they'll say, I want a congregate nutrition site nearest to me. You'll be given a phone number and address, and that might be the end of the call. What we really envision in the No Wrong Door system is you do that, and then you might say, are there additional services that we can offer you? Here's a sampling of some other services. Do you need transportation to the site? Do you need interpreter services? Do you need caregiving services? It would be more a holistic intake. And, it would be voluntary. If somebody wants to do the intake, great. If they don't, and they just want the information they ask for, that's okay too. But it would be much more holistic, I would say. And like I say, over time, we see No Wrong Door expanding to other areas, maybe employment or housing, other types of transportation services. So it would be iterative and it would grow over time. But initially, it would be probably a lot of the services that AAAs and ILCs are currently used to giving their customers, just in a more packaged, holistic manner.
I do not see any other questions, so I think Janice was up.
Real quick, Cindy, I think there was a question in there, in the Q&A. I don't know if you're able to see that.
Oh, okay. I've got chat up, but not Q&A.
We do have a question from Maggie Kraft. AAAs and ADRCs are already expected to have these NRD systems. Will those require element change, and will they stay widely?
It sounds like it might be pertaining to the No Wrong Door system. Are you able to ask the question? I can't read the.
Maggie, this was your question. Do you think you could come off mute?
Let me allow Maggie to talk. Maggie, you
Thank
should be
you.
able
Yeah, I can't come off mute without your permission. Thank you. It was hard to type on my phone today to do that. Thanks for, my question really is thinking about this no wrong door system and how it's being, talked about as if it's a new kind of thing. I was always trying to believe that the ADRC system and what we are being expected to do locally was creating that no wrong door system within our communities. And so I just wonder, and it sounds like what you're talking about, Mark, is like more of a statewide call center that people can call and get all this information. And I guess a couple questions. One is, how is the statewide system going to ensure they have the most up-to-date information? And second, won't they most likely refer that people back to their local communities? And so are we still going to be keeping the same information for our local communities at a much deeper level than you'll be able to do at the state level? And I just wonder if this is some kind of the potential for a duplication of services. In other words, US Aging has an elder care locator, and they have some basic information about all of us, and then people can get to us for more. Is your idea to create that kind of elder care locator for California, or is it the intention to actually provide more direct services at the state level? It's real unclear to me where this, how this looks or what this is meant to look like.
Right. Thanks for the opportunity to clarify, Maggie, and I'm really glad that you're asking this question. First of all, yeah, it's not our intent to create a statewide call center. That's why I try to refer this to as a call solution. Really what we see is, as you said, building off the work that the ADRCs are already doing, or should be doing, which is providing enhanced information and assistance and person-centered counseling to anybody who needs it, right? I think maybe that the difference or nuance, and again, I know that, AAAs, ILCs have different relationships and view the ADRCs maybe in slightly different ways. Some view it as separate standalone programs. Some see it integrated in with their core AAA and ILC services. I think it's that latter model that we're really looking to. So if anybody calls into a AAA requesting services, you would offer the intake form, right? And again, that happens in some, but doesn't happen in all, where it's kind of like, okay, you're asking for congregate nutrition, let me get you to a meal site. Now, can I please, tell you what other services we offer that you may not be aware of, and really do more of a robust sort of like conversation with them, or be prepared to do that. So I think for those AAAs and ILCs that have ADRCs, you should be positioned to do that today. So you're absolutely right. But not every AAA or ILC has an ADRC. So if we do a no wrong door system, I think that we would want to at least fund those AAAs and ILCs for the enhanced INA portion, the person-centered counseling portion of the work. So yeah, but no, we're not envisioning like a single call. We don't want to duplicate services. You're the experts. It'd be a federated call solution. The calls would come to you. The only other consideration that we're thinking about is, should this be 24/7? And you're not right now staffed to do 24/7 or, weekend coverage. So, would that be done by AAA or ILC? Would there be a contract with another provider to do after hours type calls? But yeah, no, yeah, absolutely. You're spot on, Maggie.
Thank you.
Anna.
Hi, everyone. I just wanted to say hello. This is my first meeting with all of you here at the Department of Aging. So I just really excited about this conversation and appreciate the dialogue about it. And, just wanted to kind of piggyback off of what Mark just said, that, we really are looking to a statewide solution and not to duplicate, right? The ADRCs are this critical component of a California no wrong door system. And actually, you've maybe heard me say this before, but that's where the magic happens. That's you all are working individually with your local resources and services that are going to support the individual needs of the people that you're working with. I think that what would be great is through this solution is sort of have a way to get statewide coverage, have a way to also ensure that people that aren't already connected with you and don't know where to get information have a place to go, if nothing else, if they're not already connected to the systems, right, to get the information they need and get directly down to your local resources, your enhanced INA, your person-centered, the support you provide to help people navigate across those services and programs that they need. So great conversation. Thank you.
Hello.
I'm so sorry. I did see a hand up.
Yeah,
Rita Sign.
Yeah, that's me. So I'm going to make this short because I know we're running behind. But one of the things that you're probably all aware of is the program to turn infants into fire stations. It's called the No Wrong Door, Safely Surrendered, and it has been pretty successful. One of the things that I don't see is advertisement for the ADRCs or the AAAs. And one of the things that we did at CDSS when I was director is we worked with people to create a template for how to advertise your services. And the state, through our graphics people, put together the poster or the handouts, and the templates were sent to all of the boards of supervisors and all the programs that we wanted to participate in this program. And it might be worth thinking about having such a template developed for the ADRCs or the AAAs that they then could distribute to their local people, so that there is a uniform presentation of the AAAs and the ADRCs. So that, I might live in Ventura, but my aunt lives in LA, and I see the thing saying these kinds of services are available. And I call my aunt and I say, you ought to really look to see if these services are available in your area. I think there's just not a lot of public awareness of the ADRCs and the extent of the work of the AAAs, although all the providers know, but each of them is working to advertise their own services. So just a thought.
Yeah, if I could quickly respond to that, Rita, I am so glad that we're having this conversation, that there's so much interest in it, because it feels like we're all kind of like thinking the same way. We're very aligned on an approach to a no wrong door system. That is one of the other key components of the no wrong door system, Rita, which is branding is going to be so important to this, right? I mean, I hate to say, people don't know what an ADRC is. It's an acronym. They don't know what a AAA is. They don't know what an ILC is. It's just, it's letters. I think the branding is going to be so important to this, whether we call it like Aging and Disability Resource Hub or something. And we will wind up, as we undertake this effort, doing branding and focus groups with older adults, persons with disabilities, caregivers. What terms resonate most to them? What's the plain speak term? That if I say I'm an older adult, I need resources, and I want to go to www.agingresources.com, whatever it is, right? Just something simple, easy, and that it's really represented like this is government, this is a trusted source, this isn't some broker, this isn't some person trying to make money off of me.
Right.
That's really going to be important. And then just the marketing and outreach. And I think that outreach is going to look different. It will be a conversation that we all have, because we can do statewide outreach and media campaigns to promote a system like this. But in each of your communities, that outreach might look a little bit different. So we really want to find out what's the best way to reach your populations.
Thanks, Mark. Elaine, you've got your hand up.
Thank you.
I'm all for this, and we're doing some local branding and things like that, and it's gonna get, you know, I welcome the state. My concern is, and I've been a service provider before, and that's why I have these concerns. Our ADRC is about a year old, right? And we've gone from no calls to between 600 and 800 a month.
Whoa.
Hugely successful, right? Now, if we do more outreach, how are we gonna, how is my provider, because we contract with the local ILC, how, I got it right, Letty?
Yeah.
So the funding has to come, because it's going to be an explosion, and we're not going to be able to handle it. And it's a real concern. So I can see it from the provider side. How much outreach should we do? Because we're at capacity funding wise. So I think we need to really be cognizant of that before we just create a plan and push it out there.
Yeah. And you know, the thing is, your ADRC may not need it, but some other ADRC might. So it's a matter of choosing what is appropriate. And of course, the bottom line is you don't want to frustrate people and have them call and not be able to be served after you've advertised, because that just creates more of a problem for them. So capacity is really critical.
Yeah, I agree. And it's one of those things. In some ways, I would really hope that would be the outcome, because it would show that, you know, older adults, persons with disabilities now are understanding and taking advantage of valuable services. But I think the other key would be being able to nimbly increase capacity, right? And we kind of experienced it during COVID. We have a little bit of experience with this. And so it's like, how do we get more money into the system? How quickly can providers set up? Because we want people to come. This is our goal, right? But how quickly can we really ramp up? Yeah, those will be important conversations to have.
Thank you. This has been a great conversation. Appreciate it. I do not see anything else in the Q&A, and I don't see anything else in the chat. So now Janice will give it a shot again.
Sounds good. So I'll go ahead and give a quick update on Medicaid administrative claiming. So as many of you know, CDA worked with consultants from the Lewin Group to help with the development of Medicaid administrative claiming. Our contract with the Lewin Group ended in October, but prior to their departure, they helped us revamp our time study methodology, and we conducted a pilot time study with this new methodology. So we conducted a random moment time study that ran from August 15th through September 15th. There were 121 staff participants from 19 organizations representing 15 ADRC partnerships. After analyzing the time surveys and submitted costs from ADRCs, CDA determined $196,000 as the potential amount of reimbursement for 1 month. This translates to approximately $2.3 million that could be claimed annually statewide. So with full participation from all 24 designated ADRCs, which includes 31 AAAs and ILCs, we estimate that ADRCs can potentially claim up to $5.6 million annually statewide. So we hope to continue conducting additional quarterly time studies in the future to continue exploring the potential amount of reimbursement that could be claimed and increase our claiming potential. So if you have any questions about MAC, please email us at mac@aging.ca.gov. Thank you.
Thank you.
Great. Sorry. Thanks, Janice. Any questions? Okay. Mike, I think you are on.
Yes, thank you so much. So I'm with our HICAP program, and I am one of the leads for the Medicare Improvements for Patients and Providers Act, which is divided up into 3 grants. And one of those is ADRC, one is AAA, and one is SHIP. So as far as funding updates for that goes, I think the last time we met, we were in the process of applying for the next MIPA grant, and that began in September. So we were awarded that grant September 1st. The grant period is September 1, 2024 to August 31st, 2025. So we did get that grant. Also, soon there will be a no-cost extension amendment coming out for those programs who were unable to expend the full amount of their funds from the previous grant. It won't affect all of the programs, and we won't know which ones until that funding is calculated out. But there will be an amendment coming out for those programs. And the no-cost extension is essentially not additional funds, although it may look like it in the budget. It is actually just an extension in time to finish up activities that the program didn't have a chance to finish up during the original grant period. And that will extend until August 2025 as well. And those are the Medicare Improvements for Patients and Providers Act funding updates. Thank you.
Thanks, Mike.
Any questions for Mike? Okay, Letty, I'll turn it back to you.
Thank you. You're following the agenda along. We are on agenda item number 6, the ADRC Consumer Experience Survey. And our presenter today is Wilson.
Yes, hi everyone, Wilson again from CDA. I think on the agenda that was released, it does say Sandra, who's my colleague. Unfortunately, she wasn't able to make it, so I'm filling in. So before I share my screen, I just wanted to provide an announcement of how many people that we've touched during the fiscal year of 23-24. Our ADRC partnerships touched the lives of 169,870 people. That's a lot of people's lives that we were able to listen to, understand their needs and their goals, and be able to provide options for them to live the life that they want to live. So I want to start off with that as our quantitative data in terms of how many people we serve, over 169,000. Now to our qualitative data, for a long time, for different generations of this advisory committee, we have always talked about, we collect quantitative data, but what about qualitative? Like, how are people actually receiving, the information and the services, the navigation services that we're providing? And so we finally have a year's worth of data, qualitative data, in what we call our ADRC Consumer Experience Survey. So this presentation today will, I'm going to cut it down just a little bit, but everyone has a copy of the full slide deck. But this presentation will, again, focus on the qualitative data. And again, our purpose is to really understand and get some insight about the consumer's overall experience with our local ADRCs. Fortunately, we were able to get 1,261 responses between just 15 ADRCs that were reporting. Let me go ahead and move the slides forward. Excuse me while I move it to this page. Overall, the responses were positive. In fact, 60% of respondents actually provided a contact number for follow-up. So that's a lot of people that say, hey, feel free to contact me if you have any further questions. I'd be happy to provide additional details. Probably not a surprise to most, is that as part of the survey, we do ask, what are the most frequently requested services? And housing, of course, is number 1 on the list. Then we have also equipment such as assistive technology equipment, such as wheelchairs, walkers, and other assistive technologies. We had requests for home repairs, transportation, food services, fall prevention, application assistance, and also referral, information referral, and emotional support. I'm not able to advance my slide. 1 second. Okay, there we go. So there were, I think, 8 questions in the consumer experience survey. Question 1 revolves around my interests and needs were discussed. 90% says that their interests and needs were discussed. There's some technical difficulty there. Question number 2, 94% agree that they were treated with courtesy and dignity. Question 3, around 83% says that I have more information and choices because of the services and assistance I receive. 81% says that they feel that they're more confident, that they will be able to manage their lives better because of the services and assistance that they receive from our ADRC partners. Question 5, 77% agreed that the services and assistance I received improved my overall health, safety, and or well-being. Number 6, we asked, if there's anything that we could have done better, what could that have been? And there's 2 slides on this, one of them being that there were a variety of responses that mentioned communication in some form. So this would be something that we'll work with our ADRC partners on. Some examples, they say, to give a better explanation. They mentioned about, never called me back, never heard back, hard to get in contact, better checking in, more follow through, work with someone who cares, showing more empathy, be kind and slow down, be more clear, and then more communication so everyone is on the same page. So I just wanted to caveat this with that this is kind of more in the minority in terms of these comments. However, it doesn't minimize it. So we'll definitely work with our local partners to figure out, how can we improve our communication, better explanation, and also maybe even providing trainings that can, that relate around communication. Continuation of what could we have done better? There were, like I said, most of the responses were overwhelmingly positive. In fact, we had over 137 responses that had praise for our ADRC program. Just a few here listed. For the current ADRC, the recipient or the person that replied says that they received white glove services. And for Monterey ADRC, someone had said, I was provided excellent services and follow-up. For the Motherlode ADRC, they said, God bless this organization. We've been helped time and time again. And for the Nevada ADRC, they said, everything was great. I was blessed to get a Chromebook. So they must have been connected with a device that enabled them to be able to access the internet. Question 7, we asked, what kind of help or services were you looking for? And just kind of recap of what we mentioned earlier, there was over 147 responses that mentioned housing. Again, not surprising to us. Whether it's in Los Angeles or Kern, Monterey, Nevada, San Bernardino, there were plenty of responses that mentioned about housing needs. And last question we asked them was, based on your experience, what did you find the most helpful? Starting with the most helpful, with 35% of respondents, they said that the most helpful was that they received information referral for services, followed by 27% that says that I said what my goals were, and I was given choices to meet my needs. Followed by 22% that says I received help for urgent need. And then we had about 10% or less that said, I received help going back to my home after being in a hospital or other place that cared for me. And also saying that others too, that it's not listed on here. Last slide is, now that we have, again, 1 year's worth of data, here are some kind of recommendations that we came up with that we can improve our service to our consumers over, for the next year. Is we look forward to continue implementation of these surveys at least once a year. We do ask our designated ADRCs to provide at least 50 administer at least 50 surveys and get 50 responses. We are also talking about maybe even utilizing Microsoft Forms for the next survey, which would give us some additional capabilities for us to analyze the data. I'll stop there. Any questions or anything? I'll turn it back to Letty and Cindy.
Thanks, Wilson. Are there any questions from the group or feedback? That was a great presentation, and it is really exciting to have a full year's of feedback at this point.
This is Ramon. Can you hear me?
Yes.
Oh, good. I mean, this is really startling, the data on housing needs. Are we going to forward this to any policymakers so they see what we're seeing?
Well, that's a really good. Wilson, do you have feedback on that?
We certainly have this slide deck and data, and we'll and we have, we are constantly, especially our executive leadership, have been in communications with legislature and the governor's office and our Health and Human Services Agency. So, we definitely have the information to share. I'll defer to Mark or executive leadership if you have any additional.
Yeah, no, absolutely. This kind of information is so valuable because I think that the questions that we usually get, whether we give this presentation or not, we're always getting questions about what are the needs of the community, who's serving them, what are the quality of the services being provided. I kind of talked about defining those core programs in NCA 2030, and one of the core programs is absolutely information assistance, right? So I think this information is just so needed and so valuable. The best information you can get is information that comes directly from our customers. So yeah, absolutely. I mean, again, we might not formally share like a report, but we definitely use this data to let folks know what we're doing and how we're doing, and what the needs of our community are.
Well, maybe we could, like, at least the master plan for aging process, flag the housing need for them.
Oh, yes. And believe me, they're well aware. I think you'll see in the latest round of MPA initiatives, a strong focus and emphasis on housing. Absolutely.
Thanks for.
Thank you.
Carol. I'll read what I wrote down. Great to see the high percentages for questions number 4 and 5 pertaining to consumers feeling more confident about themselves and also feeling that they got the information that was helpful to them in order for them to use the enhanced information and referrals.
Thank you, Carol. I see Rita's hand up. And you're muted, Rita. Can you hear me?
So I'd like for the department to reconsider whether or not they put this in some sort of form that's distributed. It would be, I think it would be, even if it was a couple of pages, it would be useful for ADRCs seeking additional funds from their counties. And also bringing this to the attention of elected officials. I think I think one of the PowerPoint pages you skipped was the one that said that there was a 38% response. That's like kind of outlandish to get such a response from a survey. So I really think you should consider at least sending us, something that we can show to people and say, this is what we're doing. This is what you can count on if you're working with the ADRCs.
Yeah, I think absolutely the slide deck can be shared. No, yeah. And yes, I think you make great points, Rita. I think that this is very valuable information as we have opportunities with, say ledge briefings or meetings with the Department of Finance showing this. Because yeah, I think as we all know, the best information is information that comes directly from our customers. This is what they're telling us. And so, it's always good to show folks this is what people are experiencing.
Yeah, it's great. It's great. Wow. It's a fabulous reflection of what people are doing, and it's impressive.
And right, a 38% response rate is fantastic for a survey
Yeah.
like this. Usually don't see this kind of response rates. Very encouraging.
This is Wilson. Just want to caveat that the 38% response rate, the slide that skipped over, is for specifically mother load. We actually, we don't know. These are just the response rates that have been shared by ADRCs because we don't ask for that. But mother load did offer, again, they had a 38% response rate, which is terrific. I don't know how it is, statewide.
What do they do? Go and chase after people? I mean, it's really remarkable. Okay, thanks.
Thanks, Rita, and thank you, Wilson, for that clarification. We do have 3 minutes before our 10-minute break, and we did also just have one more agenda item before then. And I don't know, Cindy, what you suggest?
I think we can dive into it, and because I think it will go over a little bit, but I think we can make up for it on the other end of the break. So
sounds good.
So thanks, Letty. Everybody received as part of the agenda and minutes the committee's 24-25 work plan. It has been adopted. So I'm hoping you all have had a chance to take a look at it. Part of what we're looking for is in an effort to support ourselves in accomplishing our goals and objectives. Wondering if any of you have suggestions on potential presentations or speakers that would be helpful for the committee to hear. And just so that the objectives in high level of enhancing and implementing the ADRC designation criteria and processes. For goal 2, in increasing public awareness and access, it's updating the ADRC vision, mission, and core value statements. For goal 3, supporting continuous quality improvement, establishing standard ADRC training plan, curricula, and technical support in ADRC core components, including person-centered practices, options counseling, intake assessment, and other core components. And then for goal 4, maintain compliance with program requirements, it's updating and enhancing monitoring policies, procedures, and tools. And then finally, for the partner with stakeholders, internal and external, is develop and implement the MAC process for supporting ADRC no wrong door systems and functions. So any ideas that folks have? Hoping for raised hands. You can put it in the chat. See, I told you, Letty, it'd be a quick one.
Yeah, we might have.
So it's hard to put people on the spot. I get, and saying, who do you think? So it would be really great, even throughout the meeting today, if you have some ideas, in throwing them in the chat, or even afterwards, a couple of days afterwards, take a look at the work plan and see if there is anything you have seen that comes to mind that will help us move the work plan along. See, I can sit with silence. Hopefully. Okay. I won't put anybody on the spot. We'll go into a 10-minute break, and if you have a brilliant idea, we'll look forward to it in the chat when we get back then. So it is 11:30. So let's plan on coming back at 12:40, not 12:40, that is wrong. Now listen to that. Plan on coming back at 11:40.
Thanks.
Hopefully everybody's back. Looks like some are. So Letty, I'll let you go ahead and get us started.
Thank you and welcome back, everyone. We're on agenda item number 8. It's our ADRC Spotlight. So we're really excited to introduce today's speaker, Vanessa. Please correct me if I'm wrong. Is it Akane or Asain?
You got it right the first time. I wish it was
okay.
the second, but it's okay.
From the Central Coast ADRC. Vanessa joined the Independent Living Resource Center, or ILRC, team in 2021 and provided services to the community as a youth specialist, transition coordinator, housing and support specialist, and now she holds the role as program manager. Her work with ILRC highlights the importance of community unity in addressing social and systemic discrimination and fostering access to intersectional, culturally competent, and person-centered care. I'm really excited to welcome Vanessa, and she's going to share a success story with us.
Thank you so much, Letty, for that introduction. I'll go ahead and share my screen. Let's see. Would it be possible to share my screen?
It should be.
Okay. It says only one can share at a time, but if I can't share, I can just read off my slides.
No one's sharing the screen at the moment. Okay, let me go ahead and start reading off, and I can pull up my version too and see if we can get that working.
Okay, sounds good. So, last year we were able to assist an individual who was incarcerated for 27 years, transition back to the community. After 27 years, he came back to a way different world than how he remembered it and had no resources or support. Oh, there it is. The individual said that we could share that picture. So if you wouldn't mind going to the next slide, please. Perfect. And through engaging with our housing and support specialists, as well as our AAA, we were able to assist him with searching and eventually obtaining permanent housing. And so with our contract with CalAIM, we were able to provide the housing transition and navigation services and housing deposit to assist with some furniture items. We were also able to assist him through the Department of Rehabilitation's Community Living Fund. He was really excited about an air fryer that he got because he learned how to make a meal and he hadn't cooked in almost 30 years. And so that was really exciting to see. And I believe he's still working with staff to learn new recipes. And if you wouldn't mind going to the next slide, please. Perfect. And it's a bit difficult to read, so I'll read off this handwritten letter that he sent in to us. It says, "To whom it may concern, I am a parolee who served 27 years in the men's California prison system. I recently was paroled in March of 2023 as a lifer inmate who came out of prison into a world that was completely different from when I left, which was in 1996. The reason I am writing this letter is to personally say thank you, but also to the Agency of Independent Living Resource Center, who has and continue to be a tremendous help unto me. Your agency and caseworkers helped me to transition back into a place of normalcy by offering numerous resources that relieved a lot of mental and financial burden that I would not have been facing if it wasn't, that I would still be facing if it wasn't for your assistance. These resources allowed me to stay focused on my parole and job hunting. It gave me the confidence talking with people to help me navigate through society and building a solid foundation to build on. Without these resources that was provided to me, I would have been left struggling, which would have made my life more stressful. The agency has set me up for success. Again, I want to thank all of you for being so caring and empathizing with former incarcerated individuals like myself. If there's ever anything I can do for your agency to help pay it forward, please let me know. You guys are doing something really positive, and I wish all of you the best. May God bless you all. And he signed it off. And so I appreciate the time to spotlight one of the many stories of how we have all worked together to be able to serve this individual. And thank you for your time.
Vanessa, thank you so much for sharing that story. Yeah, let me see if I can see who. Do we have feedback questions for Vanessa? Was that Rita?
I just think that's what we're here for. That's the reward, that we can serve someone like that.
Yeah, I agree. It's not often, I think, that we hear that particular success story. Incarceration is definitely a form of institutionalization. So how wonderful to hear that this individual was helped and integrating back into our society after 27 years. So that's really wonderful. Thanks again, Vanessa. I don't know if there's anybody else that has feedback. I see in front of my glasses. I'm sorry. Kelly?
Hi, Kelly Takasu from Alzheimer's Los Angeles. Thank you so much for sharing that story, Vanessa. It was heartwarming, and try not to tear up because it's just so emotional. I was just curious, how did he get connected? Like how did he learn about the services available?
Yes, so we have had individuals who have left prison before and have gotten in contact with them. I believe it was through another parole officer who recommended him to our center.
That's so great to hear. I don't know if anyone else has this experience, but I know we get a lot of letters from incarcerated people that just they write to the community as they're about to be released. But yeah, what a great opportunity for outreach as well, the California Department of Corrections, the Parole Division. Thanks, Vanessa. Is there any other feedback? If none, I, on behalf of all of us here, Vanessa, thank you so much for that story. It really was a great one.
Of course, thank you for letting me share, and I appreciate all the work all of you do.
Thanks, Vanessa. I'm going to hand this back now over to Cindy.
Great. Thank you, Letty, and thank you, Vanessa. That is a great story. So agenda item number 9 is the ex officio partner updates, and asking folks to take about 4 minutes per agency. But we're going to start with, and I'll probably go over the 4 minutes. Start with the California Association of Area Agencies on Aging. And I would just like to, Mark did it earlier, but I would just like to also recognize the work that Michael has done at C4A, as he is, and thank you, Michael, for agreeing to come on, even though you left last month. It has truly been a pleasure working with you in your role at C4A. You have truly helped the organization take many steps forward. I also have the privilege of having worked with you in the past, so I look for the possibility of working with you again in the future, and would love to have you say a few words and then also introduce Christina.
Great. Thank you, Cindy. Yeah, I've had the privilege of working with you for a number of years as well, and even before I had this position at C4A, and I really enjoyed it. And I too look forward to the potential for working with you in the future. I have to say, I really enjoyed being AAA, C4A director for the last 3.5 years. I think we've come a long way as an organization. I'm really heartened by the number of AAAs that have embraced ADRCs and are either designated or in the process of being designated and evolving. And I really do have one concern, and I mentioned it earlier. I do want to make sure that we continue to look for ways to adequately fund the emerging AAAs as they go forward. And I think the Medicaid, $5.6 million is a chunk of change. It's a good chunk of change, and that'll be very helpful. But we should be looking for other ways and additional ways to fund AAAs as they go forward, so they can fully realize their potential, because they are really the essential component of a no wrong door system. And so I'm sorry, I'm going to miss working with you all going forward on this committee, and I wish you the best. But what I'm heartened by is that we have an absolutely spectacular successor as executive director at C4A, Christina Mills. And I couldn't be happier, that she's come on board. So I'd like to introduce Christina. And, Christina, you want to say a few words?
Thank you, Michael. Well, first, I just want to say that it is absolutely wonderful to be back in this space. And for many of you who know me, you know that I was very passionate and am very passionate about the ADRC model, and it being really the base and foundation of what the no wrong door system should be and look like in California, but of course, much wider. With that said, Michael has been amazing. And when I was in my role as executive director of the California Foundation for Independent Living Centers, I will never forget when Michael came on board and graciously allowed me to write him a script, not knowing me, but maybe 2 days at that point, for our joint virtual conference during COVID, fully trusting me and allowing me to introduce him to the world through that virtual conference, and taking over for the longtime executive director, Daryl Kelch at that point, who I had years of partnership with in really creating the ADRCs. So the ADRCs are near and dear to my heart, and I would be remiss if I didn't say that C4A's #1 legislative budget priority this year is expanding and increasing ADRCs. So I look forward to using the materials that have been shared so far today. And also just want to kind of just bring in that we just recently started working with a brand new CBO CalAIM coalition that had its first meeting this week. So I think that there's some partners around that table to bring here for maybe some MAC presentations and others that would be helpful for ADRCs. Michael, I've said this many times, I'm going to miss you greatly, but you've done an incredible job of getting C4A to this point and continuing to hold the flag for ADRCs for the AAAs. And we will definitely miss you. Thank you.
Thanks, Christina. And I look forward to you carrying that flag to greater heights.
Thank you both. Christina, welcome. Michael, you will be missed. So, Christina, anything else you would like to add as far as the report out?
No, I'll keep it short this time, but thank you, Cindy, and I'll be more prepared to give a fuller report this next time.
Thank you. Okay, up next, California Department of Veterans Affairs. I think David?
Yes, can you hear me?
Great, I can.
Excellent. So I'm just going to do a quick report out on the Veterans Support Self-Reliance Grant Program that's being administered by CalVed. For those that might be new to this group, in October 2022, we released a NOFA, $20 million NOFA that would provide funding to nonprofit organizations to provide a higher level of on-site support services for veterans aged 55 plus, veterans who are high acuity and reside in permanent supportive housing projects across the state. And the purpose of this grant program is to provide expanded on-site services so that that population can age in place comfortably. So this we're 18 months into this program, and we've already hit the enrollment goals that we set out to hit on day one. So we're very, very happy that those grantees that are involved in this program have had a certain level of success in getting people enrolled in the program. It's a 3-year grant program, so we're roughly halfway through this grant program, but we do have a legislative report due on February 1st of this year, despite the fact that the funding goes through June of 2026. And that is required in budgetary language, and we're required to report information on awarded grants, project descriptions for each grant award, the findings of any research conducted during the grant program, and recommendations to improve the quality of life of veterans. Additionally, we've contracted with RAND, the RAND organization, to conduct an impact evaluation on the program. That will be completed in August of 2026. We did just receive a preliminary evaluation that we're not able to distribute or cite at this time, but when we can do so, we'll be happy to update the group with the findings of that preliminary report. And that's all we've got for VSSR.
Great. David, thank you very much. Appreciate it.
You're welcome.
Up next is California Commission on Aging. I have not seen Carol or Lisa, but just want to throw it out there just in case.
Good morning. This is Ben. I'm here for the California Commission on Aging.
Thank you.
Good morning, everyone. My name is Ben Howdige. I'm a new commissioner on the Commission, California Commission on Aging. I'm happy to be here and represent the Commission. It's a huge honor to serve on the Commission, and I've known Carol for many years and worked with several of the commissioners in various projects, commissions, committees for many years. So it's an honor. I also know a few folks here, so it's good to see a few of you that we worked with in the past. I'll share some brief updates from the commission. Just pull them up here. So next week on January 21st, we have an event, What Legislators Need to Know About Aging and Disability. That'll be on January 21st from 10 to 12. We welcome everybody to join us, and I'll put the link here in the chat in case you're interested. We do have 2 new commissioners just appointed recently. Governor appointed Jeannie Parker Martin. She's the president and CEO of Leading Age California. And also Speaker Rivas just appointed Dr. Lenore Tate. She's a practicing clinical psychologist who worked for the legislature for 15 years. So 2 new commissioners on the commission. We are working on our legislative platform. To date, the commission expects to sponsor a bill to either extend or eliminate the sunset date from the Bagley-Keene Act. And we're also considering some budget requests at the January 21st general meeting focused on Home Safe, Housing and Disability Advocacy Program, and the community care expansion. And we're anticipating looking for support and partnership from the Aging and Disability Network on these budget requests. As you know, Commissioner Cheryl Brown, her term ended on the commission. We are sad to see her go, but I'm excited because I happen to live here in San Bernardino County where she resides, and I know we will still work together in various committees here. But the Cheryl Brown Gerontology Scholarship that we just launched at Sacramento State is now accepting applications. Inland Empire Health Plan, where I work, sponsored scholarships also, and those scholarships will be available also this next fall. So if you know anybody interested in gerontology, there's some scholarships available from the California Commission on Aging on the Sacramento State website. We also encourage everybody to sign up for our Age Watch newsletter to stay up to date on commission activities. Our website is ccoa.ca.gov. If you're interested, I'll put the link in the chat so you can join and stay up to date on upcoming meetings, projects, activities, and be informed as to what the commission is supporting in the legislature this next year. So thank you so much for your time. Glad to be here.
Great. Thank you very much, Ben. It's nice to meet you.
Nice to meet you.
Next up is the California Foundation for Independent Living Centers, and I think Dan is on. There we go.
Hi, good morning, everyone. Dan Okenfuss. I'm the Public Policy Manager for CFILC. Our Executive Director, Brett, is on medical leave, so we wish him good well and good tidings, and hopefully return soon. I just wanted to say congratulations again to Letty for being the co-chair of this body. It was our honor to circulate her nomination through all of our board of directors at CFILC, and welcome again to your co-chairmanship, and also a fond farewell to Eli for his years of service to this body. So that is all I have, and I will yield the rest of my time to the next speaker.
Thank you very much, Dan. Next up, California Department of Developmental Services. I'm not sure if anyone joined the call. Hearing and seeing no one. Moving on to California Department of Healthcare Services. Gina, I think you're on.
Yes, definitely. Thank you. Gina Gunther with Department of Healthcare Services. I have no updates at this time, but I do have a really quick announcement. Our team has hired a new California Community Transitions, a CCT project director. His name is Joshua Miller Sehagun, and he will be joining future meetings. So I just wanted to give a little shout out to Josh. He's not on the call today, but I will be making sure that he gets added to these meetings as well. So if you see Joshua, he is part of our new team. So that was all I have.
Thank you very much, Gina.
Thank
Appreciate it. Next up, California Department of Rehabilitation Services, Regina.
Yes, hi everyone. My name is Regina Catamardi, and I am the Chief of the Independent Living and Assistive Technology section here at the Department of Rehabilitation. And it's under this section where we have our Independent Living Center grants, along with many others. And I'm going to first begin with some leadership changes. There are vacancies within our department due to either retirement or individuals seeking new opportunities for their professional growth. And however, there are coverage measures that are being put in place and that are in place. And I will go ahead and discuss these leadership changes now. The first is for our DOR Director, Joe Xavier. After holding the director position for 10 years, he has retired and acting as Victor Duran. He is the current Chief Deputy Director for our Department of Rehabilitation. And acting for that Chief Deputy Director position is Kim Rutledge. Kim is currently the Deputy Director of the Department of Rehabilitation, Legislation, and Communications Division. And then Anna Acton, who we see on this call, is with Department of Aging now. And so covering for Anna Acton is Jake Johnson, and he is the department's Chief Information Officer. And I will also be departing my position at Department of Rehabilitation as the Independent Living and Assistive Technology Chief at the end of this month. And my work has been divided up between our two section chiefs, and I'm working with them on transition plans. The ADRC work specifically will be covered by Shapri Butler, and Shapri is the manager of the Independent Living and Assistive Technology Unit. And now I'll go ahead and discuss the updates since we last provided a report out. And DOR, we provided our final updates to the 7 Master Plan on Aging goals for 23-24. And we also awarded 12 community-based organizations, including 7 independent living centers, with 3-year grants to provide services to Californians with traumatic brain injuries. We also awarded the 3-year Systems Change Grant to the Marin Center for Independent Living. The Systems Change grantee is responsible for carrying out the statewide Systems Change Network Hub program within the Independent Living Network. And this hub supports the systems change and community organizing efforts to improve independent living for persons with disabilities. And another update is the Youth Leadership Forum. This is great. We could use your help for any potential applicants. It's specifically open for students with disabilities and so that are a resident of California and they are a high school sophomore, junior, or senior. And for those that may not know, this is a week-long event that's held up in Sacramento at Sacramento State, CSUS, California State University, Sacramento. And the delegates, they will learn advocacy and leadership skills. They meet state policymakers. They also develop personal and career leadership plans. The last day to accept applications is February 28th. And the application is online, which is great. It used to be a printable one, but now you can apply directly online and you just go to dor.ca.gov/YLF. And another update in our independent living section, we completed all site visits last year to all 28 independent living centers. And it took about 7 months to do this, but we did it and it was great. The site visits really helped strengthen relationships and we all gain a deeper understanding of their local community and partners. And then we can also identify any areas of support for that ILC. And also 2 independent living grant administrators. They volunteer for the functional assessment service team. They have been deployed temporarily to the Los Angeles evacuation shelters for the LA fire, specifically to assist individuals with disabilities with access and functional needs so they can obtain the resources needed to live as independently as possible while at that shelter. And this is it for my updates. Thank you.
Regina, thank you very much. A lot of changes at DOR.
Yes.
Thank you for the update. And now up, last but not least, the California State Independent Living Council, either Carrie or Allison.
Hi, this is Allison Veramontes Non. I'll just be taking over. Carrie had to step away quickly, so I will do our updates. I'm off camera today, but I will try to be concise. Firstly, our thoughts are with our friends and family in Southern California, especially the many people with disabilities that are affected by the recent fires. In collaboration with the Nevada Silk and Nevada DD Council, the Silk here in California has arranged for hygiene packs to be distributed through 2 Southern California independent living centers. So the Southern California Community Resources and Disability Community Resources Center. While the California Silk does not directly provide services to individuals with disabilities or independent living centers, we felt it was important to support efforts to ensure people with disabilities have access to essential items for basic survival. Emergency shelters appear to be well equipped for immediate needs, but the primary challenges lie in transitioning individuals from shelters to permanent housing, especially for those who have lost their homes. The independent living centers are finding that rehousing remains the most significant barrier at this time. A next update is that our next full council meeting of the California Silk will be scheduled for April 1st and 2nd. It will take place here in Sacramento with the virtual participation option available via Zoom. While the agenda is still being finalized, we anticipate a lineup of exciting presentations and special guests. We will have an independent living center present, and we will hear from the new Systems Change Hub grant contractor and more. We will also be supporting members with legislative visits on April 3rd, and the agenda will be posted on the Silk website at least 10 days prior to the meeting. Additionally, Silk staff will be attending Silk Congress in Orlando this year. And we will be delivering 4 presentations showcasing innovative approaches to advancing independent living and highlighting the impactful work that is happening here in California. And lastly, I just wanted to share that the IL definitions guide has been completed. This was a collaborative effort and in 4 years in the making of incredible dedication, effort, and expertise from those within the IL network. The guide is now on our website for broader accessibility. And additionally, the Department of Rehabilitation will also begin attaching the guide to all independent living grants. But that is all I have for you today. So thank you so much.
Great, Allison, thank you so much. Christina, I see your hand up.
Thank you, Cindy. Just going back to Regina, I might have missed it, Regina. I heard yesterday on a budget call that the California Transition Fund that DOR had been implementing is not funded in the next budget.
Yeah, and you're probably talking about the Community Living Fund.
Yes.
Yeah, this was only one-time funding that the department received, and it's funded through general fund. And we received those dollars July 1st, 2022, and to use by June 30th, 2025. And it was one-time funding, and no, it will not be renewed after that. But we have served past our service goal. Of our goal was originally 1,360. We have served 1,427 individuals.
Wow, that's great. As a follow-up, do you have a breakdown of the organizations that utilize that?
Oh, yes. Yes, I do. I can send that to you. Yeah, all of the grantees. Yes, absolutely.
And last question, I'm assuming, given the number here, that it was fully spent.
Yes, absolutely, fully spent. We do have a waiting list because right now we are reconciling invoices because the individual is identified, and sometimes we want the provider to invoice within 90 days. Sometimes it takes longer than that. But however, if there's any money left, we do have a waiting list of individuals that can be served. And right now, it's looking it will definitely be fully spent, which is great because we serve so many people with vital diversion and transition services.
Yes. Do we know? I know you may not know the answer, so someone here may, but do we know if anybody's picking that up as a bill to push forward?
I don't know.
Okay, thank you.
Okay.
Sounds like great advocacy opportunity. Carol, I see your hand up.
Hi, Allison. Can you send the IL definition guide to my email, please?
Hi, yes, I think I can do that. I just got to get your email address, but I'm happy to do that.
Thank you.
You. Okay, Letty, I'll turn it back over to you.
Thanks, Cindy. We are at the moment for public comments. So this is an opportunity for any member of the public to provide comments on any item pertaining to this group.
Letty, I know Rick Mountcastle and mentioned Susie Singer Carter, so I wanted to just make sure they knew this was the opportunity for them.
Wonderful. I hope
Yep.
they're still on the call.
Hi, can you all hear me?
Yes.
Yes, this is Rick Mountcastle, and I think Susie she got called away to another call or meeting, so I'm going to fill in for her. So first of all, good afternoon to all of you members of the Advisory Council. I want to thank you for all of your hard work that each of you do to improve the lives of our aging and disabled neighbors. And that would also include their families and caregivers and others that are directly impacted. And I thank you for this opportunity to speak to you. My name is Rick Mountcastle. I'm a retired federal and state prosecutor, and some of my work was depicted in the Emmy-nominated miniseries Dope Sick, in which I was portrayed by Peter Sarsgaard. And in addition to prosecuting OxyContin maker Purdue Pharma, I spent a significant part of my career prosecuting fraud, abuse and neglect, and other crimes in the nursing home industry. And despite countless hours of working on those cases, nothing changed. In fact, the fraud and waste continues, and the outcomes for patients and residents gets worse. And in the nursing home industry in particular, when you have neglect like unanswered call bells, residents soiling themselves and waiting hours to be cleaned, missed meals and medication and other mistreatments, those are now the norm. And this is outrageous and needs to be changed and reformed now. And that's why I've partnered with filmmaker and writer, director, producer Susie Singer Carter to produce an upcoming docuseries called No Country for Old People. And we were here this morning. We want to introduce this important film along with the reform movement that will accompany it. And we view it as a tool to raise the consciousness of the public to the issues that you all are working on, and to look for support and solutions from the public, which we think can only come when the public is educated and becomes engaged in these issues. So, in 2022, Susie found herself in the front lines of the long-term care system, fighting for some semblance of quality of life for her mother. And despite her daily advocacy, her mother suffered and died as a result of neglect and abuse. And what Susie didn't know, but which I had learned through my work, was that she was not alone. There are millions of residents, patients, families, and caregivers who have absolutely no idea that the nursing home system is broken and it needs to be reformed. So we somehow came together, and she was a filmmaker, and I told her she should be documenting what she was going through for a number of reasons. Lawyers sometimes have a hard time taking some of these cases because they don't see the money in it. And she needed to document the pain and suffering that her mother was going through. So the documentary, it's a docuseries, No Country for Old People, answers 4 questions. What happens? How does it happen? Why does it happen? And how do we fix it? And so it explores it's been 50 years that the business models that have been in place for these facilities have been in effect, and it's continuously getting worse, and there's been very little change. And so what No Country for Old People is, it's more than just a documentary, it's a movement. And we are in the process of working with a distributing agent to have the film premiere on a premium streamer. And we've also retained the right to use it in advocacy, in education, and other ways to do what we want to do, which is raise the public consciousness, to make it a tool for advocates like yourself to use to improve the lives of our nursing home residents, both elders and disabled. So we are in the process of putting together a movement that we're calling ROAR, ROAR, respect, to ensure that all individuals, especially the elderly and those needing long-term care, are treated with dignity, and that the personal choices and values are respected. Oversight, to emphasize the importance of accountability, regulation, and ensuring standards are upheld in long-term care facilities. Advocacy, to actively promote and defend the rights of individuals in long-term care. Pushing for policy reforms and raising awareness about the need for improvements in the system. Reform, commitment to reforming the long-term care industry with a focus on improving care quality, accountability, and ensuring better outcomes for both residents and families. And we're working to reach, as I said, the largest audience possible with widespread distribution, and to amplify and educate the public about the current nursing home system. And so our goal is to shift the existing narratives, because, as Susie says often, although it's her mother's story, it's really all of our stories. So we've been funded exclusively by charitable contributions from more than 160 supporters. All donations have been and are 100% tax deductible through our fiscal sponsor, the National Consumer Voice for Quality Long-Term Care. And of course, we're putting finishing touches on the film, and we're in the process of initiating the ROAR movement, More information can be found about our film and the movement at nocountryforoldpeople.com. And there you'll find trailers, teasers, a 25-minute sizzle reel that gives a preview of the film. You'll learn about the Roar movement, and there are links to, of course, donation sites and signing up for the movement. Feel free to reach out to Susie Singer Carter or me if you have any questions or want more information. And I thank you for your time and your attention this afternoon.
Thank you so much for that. Does anyone have?
Could I get the name of the speaker? I'm sorry.
Yes, my name is Rick.
This is Ramon.
Yes, sir. My name is Rick Mountcastle, Mountcastle.
Yeah, no, I see you on the website. Thank you so much.
All right, thank you.
Cindy, did you say there was somebody else, or this was?
That was it.
Okay. I'll pass it back over to you, Cindy.
Great, thank you, Letty. So summing up, any action items, and Wilson is always the one who takes great notes along this line. So Wilson, anything that you jotted down?
This is Wilson. I actually don't have any action items at this time.
Okay.
Please correct me if I'm wrong, though. I may have missed something.
I think we're good then.
All right. Thanks for that. Well, at this point, we want to sum up our future meeting dates and agenda items, a reminder of the change to quarterly meetings and keeping new meeting time of 10 a.m. to 12:30 p.m. Our next meeting is April 18th, 2025, and we are seeking input from the committee members for agenda items.
Will this meeting be hybrid, the April meeting?
Wilson, CDA. We'll play by ear, and we'll communicate that with the committee. And Cindy and Letty will be in touch as well to see if we're going to do a hybrid meeting or it'll be full virtual again.
Okay, I'd like to advocate for hybrid because I lost over an hour of today's meeting trying to get through on Zoom, and I never did until finally I got a phone call.
All right. We'll definitely keep that in mind. Thanks, Ramon.
Thank you.
Is there any other feedback, any other input for agenda items? Seeing none, we'd like to seek a motion to adjourn today's meeting.
So moved.
I second.
Sorry, there is one more hand raised before we adjourn the meeting. And it went away. If you have a question, it's okay. We're not adjourned yet. Okay. Mistaken hand. Sorry, Letty.
Okay. I believe we did have a motion and a second. I hope we were able to catch who that was.
It was the second.
I saw Larry.
This is Sherry. I did the motion.
Sherry, thanks, Sherry. And then we have a second by Larry. If no one opposes, we will adjourn today's meeting. Thanks, everyone, for joining us. Thank you for the entire CDA team for putting this wonderful meeting together and for the wonderful success story that we heard today.
And welcome, Letty.
Thank you. Thanks, everyone. We'll be in touch soon. Bye-bye.
Bye.